Well, Keynote-365 was looking at multiple arms. They've reported now 3 of the arms, A, B, and C, combining pembrolizumab with other targeted or active therapies. In Arm A, they looked at olaparib. In Arm B, they looked at chemotherapy. And at this meeting, for the first time, we're seeing Arm C, which is combining pembrolizumab with enzalutamide. These are in patients who progressed on abiraterone. And what was interesting about this is that it was quite active and well tolerated. And in fact, one of the interesting things that I, as a discussant, pointed out was that the PSA response rate in the patients treated with pembro plus enzalutamide was actually higher in those with measurable disease compared to those with non-measurable disease. That's counterintuitive because most of the time we expect drugs like enzalutamide to work in patients, for example, with more bone metastases. So one question is whether this is getting at some different biology of a more pembro responsive or checkpoint inhibitor responsive population. We don't know that yet in prostate cancer. Overall, we know the response rate here is about 26%, 27% with the combo, which is not that different than enzalutamide alone when you look at PSA response. And the overall measurable response rate was about 20%, which is higher than pembro alone in the original studies, which were about 10%. But it's hard to compare studies to each other because these are all single-arm phase 2s where we're not looking at these in any comparison. But overall, I'd say we can combine enzalutamide safely with pembrolizumab in abiraterone pretreated patients, and I think we're going to see in a future randomized trials whether that combo will actually be sustainable.